Joint hypermobility is a prevalent problem, but do you know what it is?
Welcome back to Mobility Agility Chiropractic Performance. Today, let's talk about a common chronic invisible illness that people live with and may not even recognize it as an issue because they've been told perhaps they have fibromyalgia and they haven't been accurately diagnosed with hypermobility. Hypermobility is a condition that's caused by a genetic mutation that affects a protein in our joints called collagen. It commonly runs in families, but doesn't have to. A common colloquial term for hypermobility could be double jointed or loose jointed. And honestly, for the most part, people have no issues and live long and normal lives. And in fact, can be a benefit to ballet dancers, contortionists, gymnasts, but it can also cause problems such as pain in the joints and stiff muscles, clicking of the joints, joints that can easily dislocate or subluxate, extreme fatigue, recurrent injuries, digestive issues, dizziness and fainting, and skin abnormalities. When hypermobility occurs in the joints, it is known as joint hypermobility syndrome, or JHS. The reason it affects the whole body is because collagen is found throughout. It's in the tissues that holds our joints together, it holds our organs in place, and it helps compose the walls of our blood vessels. The weaker the collagen is due to a genetic mutation, the more symptoms of hypermobility that can occur. One of the common names of hypermobility is Ehlers-Danlos syndrome, or EDS. And there are 13 different subclassifications that indicate a cluster of symptoms that require a geneticist to actually determine which one it is. There have not been any large studies to determine the prevalence of hypermobility in a population. It has been theorized to be a fairly significant amount, over 3%. But despite this high prevalence, there is a lack of awareness. And there's no consistency in clinical presentation. And really, we're relying on physical exam for the diagnosis. And it's largely overlooked within the primary care physicians and can be missed by specialists. So this has really become a personal mission of mine to ensure that if someone comes to me in pain, that I appropriately screen them, and I use the Beighton hypermobility scale to do this. And the first place I assess someone is with a simple forward trunk flexion. I ask them to touch their toes. And if they can easily place their palms flat on the ground without warming up, I then move in to the next steps to determine, because it's generally not normal that someone can put their palms flat unless they've been training for many years in yoga or trying to do that. So if someone can do that, we then move into our next set of exams, such as passive dorsiflexion of the pinky finger on both sides, passive dorsiflexion of the thumb to the forearm on both sides. Can they hyperextend their elbows? Can they hyperextend their knees? There's a total of 9 points possible on this scale. 4 to 6 points indicate joint laxity, and 6 and above would indicate hypermobility and would absolutely require a referral to a specialist and for possible genetic testing. As a chiropractor, this is an important thing for me to recognize, because an adjustment works within the physiological endpoint of joint motion. So an adjustment could be harmful to someone with hypermobility, and we need to take extra precautions. And hypermobile patients can have severe musculoskeletal pain, and adjustments can help. We just have to make sure that we take all possible precautions to keep them safe. And ultimately, someone with hypermobility needs to be provided with appropriate stability exercises and maintain appropriate activity, because the key to decreasing your risk of complications with hypermobility is to exercise and strengthen the muscles around the joint, learn what normal range of motion is for each joint that you can hyperextend or move outside its normal range, and possibly utilize bracing or padding to prevent excessive motion during physical activity, and see an appropriately trained physical therapist or chiropractor to have a detailed joint strengthening program built for you. I hope this video was beneficial and interesting. Next week, I'll be doing several interviews with people in the community that have been either diagnosed with hypermobility or Ehlers-Danlos syndrome, because I want them to be able to tell their story about how this has affected them and what they have done to manage their symptoms. And until next time, here at Mobility Agility Chiropractic Performance, we want you to get better faster, stay better longer, because no one has time to be sidelined.
To keep up to date with future content, please click subscribe. Additional information is found in the description of this video.
All information, content, material of this video is for information purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider.